The aim of this video is to educate and make you more aware of sepsis and RESTORE2. By the end of the video, you should be able to use the tools to recognise the early signs of deterioration, support your decision making, and communicate effectively with health services. Sepsis occurs when the body's immune system overreacts, causing widespread inflammation, swelling and blood clotting. These reactions can cause a significant reduction in blood pressure, which can decrease the blood supply to vital organs and starve them of oxygen. If not treated quickly, sepsis may lead to multiple organ failure and death. There are at least 245,000 cases of sepsis in the UK every year. Up to 48,000 deaths caused by sepsis in the UK every year. Sepsis kills more people than breast, bowel and prostate cancer combined. Sepsis is as common as heart attacks. The common symptoms of sepsis in adults are very high or low body temperature, uncontrollable shivering, confusion or disorientation, passing less urine than normal, blotchy or cold arms and legs. Other symptoms can include fast or difficulty in breathing, rapid heartbeat, extreme pain or discomfort, feeling dizzy or faint, mottled or discoloured skin. Soft signs are the early indicators that someone is unwell and may have sepsis. You do not have to be a medical professional to spot them. There are three main signs: physical, mental and behavioural. Physical signs could be chestiness, cold hands and feet, off their food. Mental signs could be withdrawn, anxious, less alert than normal. Behavioural could be altered sleep patterns or reduced awareness. Sepsis risk factors for people who live in care settings are age greater than 75, impaired immunity, e.g. diabetes, steroids or chemotherapy, recent trauma, surgery or invasive procedures, indwelling lines, and broken skin. Be aware though that sepsis can affect healthy people of any age. NEWS is the National Early Warning Score. NEWS2 was launched in December 2017. It's a tool developed by the Royal College of Physicians and is recognised as a highly effective system for detecting patients at risk of clinical deterioration or death. Obtaining a NEWS2 score involves monitoring the following: respiration rate, oxygen saturation levels, blood pressure, in particular the systolic blood pressure or top reading, pulse rate, level of consciousness or new onset of confusion, and temperature. There are special charts available to enable you to record your observations and to work out your NEWS2 scores. They should be made available in every setting. You can download them from the links provided in the video details section. Based on a resident's NEWS2 score, you should carry out repeat observations at the following suggested frequency. This should be followed unless there is a clear indication not to, for example if the patient is receiving care whilst dying. RESTORE2 stands for Recognise Early Soft Signs, Take Observations, Respond, Escalate. Remembering what each initial stands for can prompt you to manage a resident that you're concerned about. Always use RESTORE2, that is, recognise early soft signs, take observations, respond and escalate if you think there is a possibility for physical deterioration. RESTORE2 is an escalation tool that incorporates the National Early Warning Score, or NEWS2, to help care home staff who recognise when a resident's condition is deteriorating. The tool determines what is normal for the resident, detects soft signs of deterioration, and uses a structured communication tool, or SBARD, to support decision making and the escalation process. You can download RESTORE2 from a link in the video description. RESTORE2 follows a simple process: soft signs, recognising the early signs of deterioration, take observations using the NEWS2 score, respond using the tool to support your decision making, escalate, get the right help, and get your message across using a standard communication approach. Always remember how to spot sepsis in adults. The key points are to look at your three soft signs, and if you see deterioration when completing a NEWS2 chart, contact either 111, your GP or even 999 if they are severely unwell. We thank you for watching this video, and we hope you found the content helpful. Links to the various resources mentioned can be found in the video details section.